Our hair is kind of that something that defines how we look and feel, but it's a fact of life. For many of us, we are going to see some hair loss over time, and it's very different if you're a man than if you're a woman. Here this morning is dermatologist Dr. Timothy Jochen of Contour Dermatology. Good to see you again.
Wow.
This really is a big issue, probably more so for women than men, but men
Yes.
too, you know, vanity, you look and you go, gee, I'm getting a little thin up there.
Yes.
We expect to lose hair just naturally, but when it comes in a bigger area, then we start to worry about that. How prevalent is it?
Well, it affects over 50% of both men and women. So and I think it's actually higher. I think almost 100% of people have some thinning of their hair as they enter the later stages of life. I mean, I'll say after 50 even, that most people are starting to see thinning of their hair for men and women.
Why does that happen?
Well, for men, it's a hormonal situation. For women, we don't really understand the cause as much.
Mm-hmm. And so, what can be done about it? Because, I remember working with a woman back in Dayton, Ohio, who had alopecia and had to resort to wigs. I'm sure that's the case for some people still today, but, have there been some strides in maybe helping people who have this?
Absolutely. The first thing you need to do when you have hair loss is figure out what the cause is. And the experts for hair loss are dermatologists. So if you're experiencing hair loss, you want to come and see a dermatologist, and we'll determine whether it's just female pattern hair loss, which is inherited, or male pattern hair loss, which is inherited, or whether there's something else going on within your body.
Stress?
So that stress can be one, weight loss, there are diseases that attack your hair follicles. So you really want to get down to the root cause. And if we get to that cause, we can solve the problem for you.
Really?
Yes.
Now, this I was not aware of, this cap thing. I mean, it kind of looks a little weird.
Well, it's not supposed to look weird because you're supposed to be able to camouflage it with any kind of cap you'd like. This one has a brand on it, but you can take this cap off, and it's basically a light device.
Okay.
So these are just LED lights that light up, and they actually stimulate the hair follicles to be turned back on, and so you'll get hair growth. And
really?
So,
just because of light?
Yeah, just the light, the LEDs actually turn on the hair follicle that have sort of gone to sleep. And so, if you put it on this way, it looks a little bit weird.
Yeah.
But if we conceal it with any kind of cap, whether you're a sports fan or whatever, you can conceal it.
And now, what's the turnaround time of using, this cap, and then you start to see growth?
Yes. Well, hair follicles grow very slowly, so it's typically 3 months before you're going to start to see hair regrowth. Now, this is not the only option that we have. We have lots of other options for hair growth as well, but this is one that's been FDA cleared.
Okay.
So, and this one I recommend for people who don't want to take pills or do topical things. This one, it's just a light source.
Okay. And probably easier without having to take ointments and all this other stuff.
I really think that the pills are still the easiest thing. I take a hair pill every single day because I don't want to lose my hair. I've been doing it for 15 years, and I have a pretty good head of hair.
Yeah.
But I cheat. I had a hair transplant, too. So.
Oh, you did?
I did, yeah.
Oh, that's got to hurt.
Not at all.
No?
No, actually. No, we use numbing, so don't be afraid. No, it's really not bad.
So are you saying that I need it? Okay.
No, I'm not saying that.
I think
people have amazing techniques for camouflaging hair loss, so I don't know if you're one of those people or not.
Doctor, thank you. All right, always a pleasure.
Thank you so much.
All right, thanks a lot. We'll take a break. We'll be right back.